Angelina Jolie put a very public face on a serious health issue that affects lots of everyday women. Lori Berlin from the Upper West Side is one of them. Lori, welcome. Thanks for being here.
Thanks for having me.
So your story is interesting because you ended up finally getting the BRCA gene testing after connecting with a cousin for the very first time just a few years ago.
Yes, it was pretty crazy. We had a male cousin in our family who was diagnosed with cancer of unknown primary, and he didn't know where his cancer was coming from. He reached out to our family. There was a test done, and it proved that he actually, as a male, had breast cancer and had triple-negative breast cancer, and which is very unusual. And I had had a previous diagnosis of becoming high risk for breast cancer. And after talking to my doctors and learning about my genetics in my family, I finally decided that I should go and have this test, never thinking I would ever carry mutation at all. And of course I did.
And when you heard the words that you did, what did you think and what did you decide to do?
Well, the first thing I thought was the genetic counselor was kidding, because I had no reason to believe I would have the mutation, because there wasn't breast cancer or ovarian cancer up and down in my family.
With the women especially.
Right, with the women. And Bernard, my cousin, and his daughter were the first two that I had learned that even had breast cancer in our family. So I was actually, after the initial shock, I was actually relieved to learn this information, because everyone talks about knowledge is power. It truly is. I mean, I knew right away, because of my previous diagnosis, that I would go ahead and have the same surgeries that Angelina Jolie had.
The double mastectomy?
Yes.
And the ovaries?
And the ovaries and tubes.
Those are grueling surgeries. How did you get through them?
A lot of great support, I must say. I mean, it is so key to have a good support system and great medical care. I had great doctors. I still have great doctors. It was life-changing, no doubt, to have the surgeries. I mean, you're physically different, emotionally you're very different, but I would do it all over again. To know that I now have a very, 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 very good chance of never getting ovarian cancer or breast cancer. I mean, to be able to say that and know that and not be afraid every time I go for a mammogram, it's great to have that information.
Some people look at Angelina Jolie, they look at women like you and see the surgeries that you've done and say, wow, that's really drastic. I don't know if that seems too drastic. What do you say to people who think that?
You know, I've been thinking about that, and, you know, this may sound like a bit of a silly analogy, but if someone told you there was something wrong with the steering wheel of your car, and there was a really, really, really good chance that something could go horribly wrong, wouldn't you do whatever you could to prevent that? And that's how I felt. And I think I had a couple of people react that way until they heard everything, and they said, oh, wow, that makes a lot of sense. For me, it made a lot of sense. I had a previous diagnosis that put me at high risk.
And that's an important point, too, that it's a very personal decision to be made by each woman with their doctors and loved ones as well. So how are you doing today?
I'm doing great. You know, after hearing the words from my breast oncologist that the timing of my surgery was great, a major event was coming, and I intervened with fate, and knowing that I was likely going to get breast cancer twice, in both breasts, I'm doing great. I go for checkups with for my pancreas, for my colon, for melanoma, and everybody's taking a good look at me, and I'm working on a breast cancer documentary all about men.
About men,
yes,
which is important as well.
Yes, the mutation all is in the men in my family. So,
and that's part of the sweatshirt we have here.
Men have breasts too, because this whole mutation affects men as well.
An important point. Lori, thank you so much for coming in. We're so glad that you're doing well.
Thank you so much.
Thank you for sharing your story with us. And to learn more about Lori's documentary, you can head to cbsnewyork.com.